Some health experts have been warning about a second wave of COVID-19 cases, but new research from the University of Minnesota shows different scenarios for multiple waves of the virus in the future. Western Mass News reporter Lindsay Kane joins us live in studio with more. Lindsay.
Sarah, the research highlights 3 different possibilities the pandemic wave might take in the coming months. But a local expert tells me the path of the virus is hard to predict.
It's not just going to stop. It's not going to miraculously go away.
While many people around the nation have been looking forward to getting past the peak of COVID-19, health officials are warning that getting past the peak does not mean the end of the virus.
It's very difficult to predict whether there'll be a wave of one larger type, whether it's in the fall or later on in the winter, or if there's other scenarios.
Researchers at the University of Minnesota are now looking at 3 possibilities for the future of the coronavirus. The first scenario predicts this current wave the country is in, followed by constant waves for a year or 2. The second prediction says the current wave will be followed by a fall or winter peak with smaller waves after that. And the third scenario predicts an intense spring peak followed by smaller waves. Dr. Jonathan Bayuk, president of Allergy and Immunology Associates of New England, tells Western Mass News over the phone that it's hard to predict the future of this virus. While he says it's not going to disappear, the nation's response could be different if the virus hits again in the future.
If we have the machinery in place and we have the quote-unquote army of tracers and public health workers, which we will need, and we look at what we did wrong last time and we make changes, then I'm very optimistic that we'll be able to open up much more than we are now.
He says he doesn't predict the nation would need the same restrictions in place for this outbreak if waves of cases continue.
If we can do all of this right next time, then I think we can look more at that more favorable scenario where this was the big hump and we see these waves over time.
Dr. Bayuk says it's important to continue social distancing and following the protocols set in place by officials in order to stop the spread of the virus. In studio, Lindsay Kane, Western Mass News.